So now we're going to talk about ethics and interpreting ethics in a medical or a mental health setting. And Jen, one of the things that came to mind when I was thinking about this is, when you are speaking the language of the patient tends to think that of you as an ally,
Mm,
and they might tell you things that maybe they don't want the doctor or the therapist to know. And we, the interpreters, are the means of communication. We're the voice of the patient and the doctor. So it it is our responsibility as professional interpreters to say everything that is said in a room.
mm,
So if the patient doesn't want the therapist to know something, they should know that if they say it, the interpreter is going to interpret. Because maybe, the therapist, I don't know, stepped out for a second to grab a tissue or something. And then the patient tells the interpreter, well, I don't want the therapist to know, but I just smoked pot earlier. And that puts the interpreter in a very difficult position, right? So as interpreters, we need to let the patients know that if they tell us something like that, when the therapist comes back, you are going to tell them.
mhm, mhm. So it's really telling the patients, the people that are clients, that your role as an interpreter is to say everything, like, because that's what you're interpreting the meaning. So even if they said, I have a pet, I have a dog named Chewy or something, that might be something you have to interpret. Is that correct? Or would you?
Yes, yes, everything. Because I don't know if it's happened to you or anybody else, and not necessarily in a medical or a mental health setting, but maybe you are in a social gathering, right? And there is, I don't know, someone, you're talking to your friend who maybe also speaks Korean. And then her Korean friend comes and says hi, and they start speaking in Korean, and they're like,
What's happening?
I don't know what they're talking about. This is very uncomfortable. It's the exact same thing. And if the patient were an English speaking person, this wouldn't be an issue. And it doesn't need to be an issue, right? So everything they say, as unimportant it might seem, as unnecessary, everything it said needs to be, and also for the therapists, right? Everything they say, because there have been professionals that tell the interpreter, don't say that, but they are saying it in front of the person, and then you're again put in a very uncomfortable position because you're the one who understands both. So it's also actually for the therapist, you need to know that everything you say, I am going to say it in the other language to keep everybody in the loop.
Such an important point. Thank you so much for sharing that.
You're very welcome.